Alrighty, here is a step-by-step of how to deliver the Zyppah-V appliance. When you get the box, it will come just like this. In it is all kinds of nifty little presents for you. First of all, we have the bag which the appliance can go in. The patient can carry it so they don't have to carry it in their pocket. And then we have the appliance itself. And then all of the supplies that are going to be needed for the first series of treatment. When you get the appliance, the first thing you want to do is seat the patient, and before you attach anything, you want to fit the appliance separately in the mouth. You have the lower appliance and then you have the upper one. I personally like to fit the upper one first, make sure that everything's comfortable, there's no tight spots on any particular tooth, and definitely let the patient know that it is a generalized tightness and there's a definite difference between pain and pressure. And then do the exact same thing with the lower. The lower one has the blocks on here, so you want to make sure that the bite is balanced on there. So you can always add a little bit of articulating paper here and put the top and the bottom together before you attach it with the elastics. Once you have the elastics on there and you're trying to open up the mouth to squeeze that articulating paper in there, sometimes it's not quite as easy as you think it is. So we like to do it without the elastics attached. The first series of elastics, you want it to be the lightest force possible. That way the patient does not have any trauma to the jaw itself. It's kind of a user-friendly, getting used to the appliance itself. Easiest way to hook it on, and the first set that you're going to use on the front, is the larger elastics. They're the 3/8, so they're a little bit different size, a little bit bigger here. And hook those on first. And I'll actually show you on both of them here. So the front hooks, we refer to this elastic as the front elastic, and that is because if you hold the appliance here, you have the front hooks, and then you have the back, which connects to the back of the appliance here. As you hook the elastic on, doesn't really matter if you hook the top to the bottom or the bottom to the top. Doesn't make a difference here. First of all, you want to make sure you got your hook there. Hook it here and hook it straight on there. So that's the front elastic that direction. And do the same thing on the side. The only reason I like to do the front one first is because of the fact that the back one will have a tendency to slingshot the appliance, and then your patient's going to get very frustrated when they're trying to do this. So you hook it up at the front, stabilizes the appliance that way. So there's your front elastics hooked on. The first set of back elastics that you use will be the 6-ounce pull. And same thing here, you grab 2 of these little guys out. And as you hold the appliance together, I like to hook the back part on first, and it goes right over that button, just like that. And then you could pull it up here and hook it around the exact same hook that the front one is on. And then you rotate it sideways. I like to keep a firm grip on there because if you let it down, sometimes it kind of gets out of position a little bit. And then once you hold it here, you do the exact same thing on this side and come up here and hook it on that hook. See how it kind of slingshots that way? So if you hook the back on first, then you get that pull, and it's really kind of difficult to get the front one on. So once you have the appliance here, it looks a little funny. The patients kind of freak out sometimes. But as you get ready to seat it in the mouth, what you'll do is you'll push it together like this. It goes in the mouth as one piece, almost like a mouth guard would go. Seat the upper first, and then have the patient bring the lower jaw forward, and that way they can bite into it comfortably. And there you have it. Easy. As far as the adjustment appointments go, when the patient comes back, first of all, you want to ask them how everything went. Most importantly, did they have any jaw discomfort, any pain in any of the jaw joints, or tenderness? And if it is one side or the other, you want to make sure that you articulate it as far as getting the bite balanced that way, so you can kind of prevent that from happening again. As you adjust the elastic sizes, the front elastic is always going to stay the same. It's the back elastic that changes, and it's not the diameter of the elastic that changes, it's the ounce of pressure that the patient's going to get, and basically it's just more force of holding the jaw forward. So what you're going to do is you could take the whole thing apart again. I'll just start from scratch here. And the adjustments will go in the different size elastics that we have here. We start with the 6 ounce, and then we also move up to the 8 ounce for the second appointment. And then it jumps all the way up to a 16 ounce on that third appointment. And so what you'll do is you'll just do the sequences of appointments and create a little bit more tension on each of those appointments. So when we start off with the 8 ounces, exact same thing that you do initially. You're going to keep that 3/8 on the front elastic, just like that. And then you'll move up. A lot of patients won't find that the 8 ounce feels a whole lot different than the 6 ounce. The transfer's pretty easy. Every once in a while you might have somebody that can really tell a difference. But for the most part, it's pretty simple adjustment. And the same thing here, you're going to hook that back one on first. And then come on up here and get it around that hook. And you will feel, personally, I feel the tightness as far as the difference in just those 2 ounces. And then same thing on this side. Hook it here and bring it up. And voila. By that time the patient's pretty used to it. You could just hand it to them and they could put it in without it being a big deal. And then what we do is when we do that last adjustment for the 16 ounce, this is the one, since it doubles the force, it is a little harder to get on because of the fact that the elastic does look pretty big. I refer to it as my macaroni noodle because that's what it looks like exactly. Nice big fat one. And same thing, you'll keep that 3/8 right at the front. And the back comes all the way over here. And like I said, this one's a little fatter. I don't know if you can see the difference here. And the pull's really tight. Just kind of get it over there. It's a little tricky, like that. And sometimes it'll roll up on the back there. You just kind of hold it there. But see how much it slingshots around, so you just have to kind of recenter it before you hook the other side on. And this is usually when the patient puts it in, they're like, oh, yeah, okay, I can feel that. And you can see the difference here of what the pull is. So when they put it in, that lower jaw is going to be held forward at a really nice tension. Okay, visit number 4. They come back in. All of these side adjustments have been done. What they need to do is add the posterior elastic, which is the tongue band, to actually hold the tongue down in place. And by this time, the patient is really used to the appliance. They can do the transition to the tongue band without it being that big of a deal because they have been wearing it for approximately 6 weeks now. So what you do, the tongue band is connected to the lower, and it's the same buttons that we used for the elastics. And so the tongue band actually will come, it's cut just like this. You've got the hole on one end, the hole on the other end here. And then what you do is you just push this down right like that, pull it right over the button, and then turn it over here, and the same thing is just pull right over that button. You want to make sure that the band does not roll up onto these blocks here because the patient will actually tear it. So make sure that it lays flush there, away from the occlusion. And then you can go ahead and put it back together again just like you had before. Now they have the tongue band here that will hold everything in place. And the elastic goes right over the same button there, so you actually have 2 things connected to this button. Pull it up here. A lot of times once you add the tongue band on there, biggest complaint from the patient is that all of a sudden they're going to start having a little bit more saliva in the mouth. That's really normal because you are depressing the tongue a little bit. So there is it in place. You put it in the mouth, the tongue will come right here, and that will hold the tongue in place so it cannot actually fall back into the airway. Okay, I want to go ahead and just discuss a few things on the acrylic blocks here. Very important for a couple different reasons. Number 1 is it actually prevents the patient from chewing down on the band here. So you want to make sure when you put the elastic band on there that there's enough clearance there that the patient is hitting the block versus the band. But also when the patient comes back, If by chance they happen to mention that they're having discomfort in one jaw joint or the other, what you want to do is you want to decrease that discomfort. If the patient happens to be having discomfort on the right side, what you want to do is decrease the block on the right side so they are hitting more on the left side, taking the pressure off of that right jaw joint. If it's just the opposite, patient's having pain in the left, you will decrease the left block so the patient primarily hits the right.